Men often have problems with prostate growth, BPH, especially those over the age of 50. Men with this disease may have trouble urinating properly, have to go to the bathroom a lot, and feel pain in their pelvis, belly, and the area between their scrotum and anus. But what's really going on here? This picture shows the prostate, a small area that lies below the bladder. The bladder is the organ that stores urine. The urethra is the tube that your pee goes through. When the prostate starts to get bigger, it puts pressure on the urethra, the small tube that connects to your bladder. And this is where the trouble starts. Your pee can't go through the tube properly because it's swollen, so the liquid builds up and gets stuck in your bladder. According to top medical experts, the prostate does more than just reproduce. The famous physician Dr. Smith says, "The prostate is like the protector of your reproductive and urinary health, and its health is an important part of your overall quality of life." Let's discuss John's story, a 55-year-old man who dealt with the challenges of an enlarged prostate. John's daily routine included a diet high in processed foods and dairy, along with regular alcohol consumption. Facing frequent urination and a weak urine stream, he sought a solution beyond traditional medication. John embarked on a significant lifestyle change, eliminating dairy, reducing processed foods and alcohol, and incorporating anti-inflammatory foods like vegetables, fruits, and omega-3 rich foods into his diet. He also started a moderate exercise routine and practiced stress management through yoga and meditation. After 3 months of these changes, John experienced a noticeable improvement in his symptoms. His urinary frequency reduced, especially at night, and he had a stronger urine stream. Additionally, his overall energy levels and mood saw a positive impact. A follow-up medical examination indicated a slight reduction in prostate size and improved bladder function. John's experience highlights the importance of diet and lifestyle in managing prostate health, demonstrating that proactive changes can significantly complement medical treatments. Warning signs of a bigger prostate. In the middle of the night when you're trying to sleep, this can make it hard to control your bladder. You might have to go to the bathroom right away, but only a little urine may come out. Your urine stream might be weaker, so it might stop and start while you pee. Or you might have to strain or push to get the pee to come out. Some research studies show that when there are chemical problems, like too much estrogen, insulin, or DHT in the body, the prostate gets bigger. Sadly, some foods have been shown to increase these hormones, which makes the prostate swell and get bigger. This increases the risk of prostatitis, infections, and prostate cancer. If you have an enlarged prostate, you should stay away from some foods. Milk and cheese. If you have trouble urinating because your prostate is too big, you should stop eating dairy products like butter, cheese, milk, yogurt, and cream. Dairy foods come from cow or goat milk and have natural growth hormones that help animals grow. These can hurt a prostate that is already big, making the gland get even bigger and putting pressure on your urethra and bladder. Dairy foods are very good for you if you don't have problems with your prostate. On the other hand, if you do have BPH, try not eating any cheese for 1 to 2 weeks and see if your symptoms get better. Oil from plants, seed oils. Most food oils come from soy, corn, cottonseed, canola, grapeseed, and rice bran, which are all GMO grains that have been processed in a lot of different ways. These oils are not vegetable-based, despite what the name says. Meats that are deep-fried, fast food, ready-made meals, margarine, and coffee creamers are all made with vegetable oils. There are a lot of toxic omega-6 fatty acids in these oils, which can cause a lot of inflammation in your liver and prostate gland. It's very important for your liver to keep your hormones in balance and get rid of any extra ones you don't need. But these processed oils weaken the liver. Hormones like estrogen and insulin then start to build up in the body, which makes the prostate grow and the walls of your bladder lose their tone and become weaker. This means you should stop eating these things and instead use extra virgin olive oil, cold-pressed avocado oil, and organic raw coconut oil to make healthy meals at home. I also think you should eat more omega-3 rich foods, like salmon, sardines, oily fish, and eggs that were raised on grassland. These reduce swelling and will fix any damage caused by having too many omega-6 veggie oils, sweets, and starch. When you eat refined sugar, flour, grains, or starch, your body turns them into glucose, blood sugar, very quickly, If you eat a lot of sugar all at once, this can hurt your cells. Insulin is a hormone that your body makes to keep you from dying. It takes sugar out of your blood and puts it into your cells to make fuel and energy. What's wrong is that your pancreas makes more insulin as you keep eating processed sugar and foods that turn into sugar. Since insulin is a growth hormone, having too much of it, hyperinsulinemia, makes the prostate get bigger very quickly. You also need to go to the bathroom more often because of the high sugar level in your blood. This is especially true at night when you are trying to sleep. Cut back on fruit drinks, sweets, cookies, cakes, bread, sodas, cereals, and foods made with flour that are high in sugar and carbs. After 7 p.m., don't eat anything and let your blood sugar level out. Soon, you'll have to go to the bathroom less often and sleep better. Not fermented soy. I already said that soy oil causes a lot of inflammation and can damage the liver and make the prostate bigger. But it's also important to know about the soy proteins that are being added to your food that are very cheap. Protein bars, baby feeds, processed meats, and diet shakes often have soy protein isolates, soy powders, added to them. Soy protein isolates make the body make a lot more insulin, which is an anabolic hormone that can make BPH, enlarged prostate, and LUTS, urinary problems, worse. Also, soy powder raises estrogen, which is another hormone that can make the prostate bigger if it's too high. Also made with chemicals that are hormone blockers, soy is GMO and is grown with pesticides, herbicides, and insects. Lastly, soy has a lot of phytic acid, a chemical that can stop your body from absorbing minerals like zinc, which are important for prostate health. If you have any problems with your prostate, you should stop eating all unfermented soy products. If you want to eat fermented soy foods that are organic, you can have miso, soy sauce, tempeh, tofu, and natto. Microbes that are used in fermentation take away the bad effects of soy, making it much better for your body. Drinking alcohol. It is a fluid that hurts the hepatocytes, liver cells, which leads to changes in hormones like higher insulin and estrogen levels. When you have too much of these steroid hormones, your blood pressure goes up, which makes your arteries and blood vessels weaker. Cut back on booze, especially beer, which has a lot of estrogen in it. Instead, try having 1 to 2 cups of kombucha tea in the early evening to help your body and mind relax without drinking too much alcohol. This fermented drink helps the good bacteria in your gut get rid of toxins and make more bile, which keeps your liver clean and your hormones in balance. Changed meats. Foods like pepperoni, ham, salami, hot dogs, and canned meats are all processed meats. These are processed meats that have been mixed with nitrates, dextrose, sugar, soy proteins, and veggie oils, among other chemicals that are meant to keep them fresh. Studies have found that processed meats can raise the chance of cancer. This is because they damage cells with oxidative stress and make AGEs, which are sticky proteins that block your vessels and make blood clots. They hurt your liver, which increases your chance of getting prostate cancer and makes problems with your prostate worse if you already have them. Stop eating processed and regular meats and start eating meats from local farms that are better for you. Make sure the meat you buy was raised on grass and then finished on grass. This will make sure that the animals didn't get any hormones or junk food. Grass-fed meat has a lot more nutrients and won't have the dangerous chemicals that are added to processed foods. Organ foods like liver and grass-fed beef are full of zinc, heme-iron, and proteins that help keep the prostate gland healthy and make seminal fluid for reproduction. Please keep in mind that everyone's body and biology are different, so it's important to try different things and see if your urinary or prostate problems get better. At the end of the video, I'll show you 6 changes you can make to your lifestyle and home treatments that can help get your prostate back to its normal size. Things like salami, hot dogs, pepperoni, ham, and other processed meats are sadly mixed with chemicals used to keep them fresh, as well as dextrose, sugar, soy proteins, and veggie oils. Studies have shown that these processed foods can raise the chance of cancer because they damage cells through oxidative stress and make AGEs, which are sticky proteins that clog your arteries and cause blood clots. They can also hurt your kidneys, which can raise your risk of getting prostate cancer and make problems with your prostate worse if you already have them. Stop eating processed and regular meats and start eating meats from local farms instead. This will help your health. When you buy organic meat, look for grass-fed and grass-finished meats. These are free of the bad hormones and junk food that are often fed to animals. Grass-fed meat has more minerals and none of the bad chemicals that are in processed foods. Grass-fed beef and organ foods like liver are especially high in zinc, heme-iron, and nutrients that help keep the prostate gland healthy and make seminal fluid for reproduction. Biochemistry and the way our bodies work are different for everyone. To see if your urinary or prostate problems get better, it's important to try cutting out certain foods from your diet. 6 reasons why the prostate gets bigger. To get a better idea of what's going on, let's look more closely at some of the most common reasons why the prostate gets bigger. First, and most commonly, eating too many refined foods, such as sugar, processed grains, and bread, can make your zinc levels drop, which can lead to higher amounts of DHT, insulin, or estrogen. By chance, being overweight can also make the prostate bigger, because extra fat raises hormone levels, such as estrogen and insulin, which can help the gland grow. The acid in our stomachs gets weaker as we age, which makes it harder to receive zinc and other nutrients that are important for a healthy prostate. Because the liver helps get rid of extra hormones, hormonal changes are more likely to happen if your liver is damaged. Non-organic foods often have small amounts of chemicals and pesticides that are harmful to your liver. This can cause hormonal changes and possibly make your prostate bigger. Also, dairy products and processed meats may make your situation worse if you already have a big prostate because they contain growth hormones and hormone offenders. How to get rid of a big prostate. Start by eating a handful of pumpkin seeds every day. They are one of the best foods for beating BPH. Pumpkin seeds have zinc, phytosterols, and vitamin E, which all work together to balance hormones and shrink the prostate. If you have trouble going to the bathroom, you might want to take 120 milligrams of stinging nettle root 3 times a day. By stopping the buildup of DHT and estrogen, this natural plant helps reduce inflammation in the prostate, which lets the bladder clear normally. Cut back on the foods this video talks about, especially dairy, sugar, veggie oils, and processed meats, because they change hormones and make the prostate swell. If you smoke, cut back and try to quit. Smoking hurts blood vessels and makes the prostate grow bigger. To keep your hormones in balance, eat a salad every day with organic cruciferous veggies like cabbage, radish, broccoli, arugula, kale, collard greens. Compounds in these veggies, such as sulforaphane and dindolylmethane, DIM, help your liver get rid of extra hormones that cause your prostate to grow. Eat whole foods like bananas, tomatoes, shellfish, wild salmon, green tea, and organic grass-fed beef. These foods all have qualities that help keep your prostate and seminal fluid healthy. Do high-intensity sprint training. Men who do HIIT for 10 minutes twice a week can see a huge rise in testosterone levels, while DHT, estrogen, and insulin levels drop. Also, exercise can help get rid of extra sugar in the blood, which may be making the prostate swell up. Lastly, you may have a fatty liver if you are overweight, especially around the middle, or if you drink alcohol every day. This can change your hormones and make your body swell. In this case, you should follow an intermittent fasting plan, in which you eat all of your daily calories in 4 hours and don't eat for 20 hours. Fasting is a good way to get rid of extra fat in the liver and shrink a swollen prostate. Thank you for watching. If you found this video helpful and would like to stay updated with more content like this, just click the subscribe button and turn on the notification bell so you don't miss any of our future videos.